Let's see an NCLEX tips and points video on acute respiratory distress syndrome and chest tube. There are some direct and indirect causes of acute respiratory distress syndrome. The direct injury includes aspiration, chest trauma, pneumonia, which is infectious or aspiration, pulmonary contusion, inhalation injury that includes smoke and toxins, and pulmonary embolus. Indirect injury of acute respiratory distress syndrome includes sepsis and shock, pancreatitis, burns, multiple blood transfusion, transfusion-related acute lung injury, cardiopulmonary bypass, or drug and alcohol overdose. Important interventions to prevent ventilator-associated pneumonia or VAP are: perform mouth care every 2 hours, brush teeth every 12 hours with chlorhexidine, keep the head of the bed elevated at times at 30 degrees to prevent gastric aspiration. Conventional ET tubes should be replaced with ET tubes with subglottic secretion drainage. These are ET tubes that have an extra port above the inflated cuff that is connected to low continuous suctioning. This prevents the secretions that sits above the cuff from becoming infected with bacteria and then oozing down around the cuff into the airway, infecting the airway. If a chest tube becomes disconnected from the drainage system, immediately submerge the end of the chest tube in sterile water to preserve the water seal. This prevents air from entering through the disconnected chest tube and reaccumulating in the pleural space. As quickly as possible, reconnect to a new chest tube system. Be aware of the hospital policy. Some hospitals have protocols that allow the immediate reconnection to the original system. The next point is, if the chest tube becomes dislodged from the chest, that time apply a Vaseline gauze dressing and notify the provider immediately. Prepare for insertion of a new chest tube. Chest tube placement is indicated if a pneumothorax or hemothorax occurs as a result of chest trauma. In the case of pneumothorax, because air rises, the chest tube is placed high, usually in the second intercostal space at the midclavicular line. For a hemothorax, due to the effects of gravity, the chest tube is placed lower between the ribs at the 5th or 6th intercostal space at the mid-axillary line in order to drain blood and fluid from the pleural space. Chest tube placement allows for the expansion of air, expulsion of air and fluid while allowing the lung to re-expand. The chest tube is connected to a chest drainage system. Essential components of a chest drainage system include: there will be a collection chamber, a water seal and suction. The collection chamber allows for the accumulation of blood and fluid. The water seal acts like one-way valve, allowing for the removal of air or blood over time without the introduction of air back into the pleural space. Initially, suction is applied to assist in the re-expansion of the lung. The suction is discontinued as the lung re-expands. Hope you understood some points on acute respiratory distress syndrome and the chest tube placement. Thank you so much. Please do keep watching for more videos which will help you pass NCLEX-RN.